Centers, as well as Dr. Sarah Reimer, who will give a presentation today on the transitions clinic that has been newly implemented here in Milwaukee. So bear with me, I'll share my screen and then we can get rolling on that presentation as well.
Thanks, Mandy. It's a pleasure to be here. It's a pleasure to hear the work that's going on, and it's so encouraging to see this conversation. I wish that our national news actually had good news like this instead of all the news that we see. I think it would encourage more people. As you said, Mandy, we're going to be talking about the Transitions Clinic, which is a model for caring for people returning home from incarceration, caring for their health needs in a culturally competent way. I am Dr. Sarah Reimer. I'm a physician investigator and a practicing physician at Advocate Aurora Health. And Jenni Sevenich is the CEO of the Progressive Community Health Centers. Next slide. So I'm going to talk about who we are, not just Jenni and me personally, but our organizations and why we are partnering to provide this program, what the need is, and how we see this as filling it, ways to meet the needs and the barriers to care, especially faced by this population, what the model is, who is eligible to participate in it, how it works, and finally, how people can access it. Next slide. So Jenni, if you'd like to talk about the Progressive Community Health Center, I'll give you this slide.
Sure, thank you, Sarah. Good morning, everybody. Progressive Community Health Centers, we actually have 3 locations on the north side of Milwaukee. We have the Lisbon Avenue Health Center on 35th and Lisbon, the Hillside Family Health Center located in the Hillside Family Resource Center. And we also have an urgent care that is right next to the emergency department at Sinai. And so we've been serving the community for 20 years, and our mission really is to improve the health and quality of life of the community by providing culturally competent services that address identified needs. So we do that we provide general primary care, so family practice, internal medicine, pediatrics. We also have women's health, podiatry. We have an integrated behavioral health program, and we have radiology, so diagnostic radiology as well as mammograms. We also provide dental services and enabling services like enrollment in Medicaid or the marketplace or on our sliding fee scale for the uninsured. We also have social work, clinical pharmacists, care coordination, group programs. And so we serve everyone who walks through our doors, regardless of ability to pay.
And Advocate Aurora Health, our purpose is to help people live well. We are a not-for-profit healthcare provider serving the eastern side of Wisconsin and northeastern Illinois, 70,000 caregivers strong across both states, 15 hospitals in Wisconsin, including the last remaining downtown hospital, Sinai. We serve a very diverse patient population. We're the largest provider of Medicaid services in both Wisconsin and Illinois, and we have a $50 million commitment to health equity to improve life expectancy in low socioeconomic areas. Next slide. So, and we really see serving this population better as part of that health equity commitment, because incarceration disproportionately impacts people who are poor, people of color, those who are disabled, and the LGBTQ. It has repercussions, as was discussed earlier, not just during the time of incarceration, but post-incarceration. There are social stigma, there are barriers to education, and certainly barriers to employment. Incarceration is associated with increased mortality and with increased incidence of chronic diseases and reduced life expectancy. And because incarceration is geographically concentrated, it impacts not only the life expectancy of individuals, but neighborhood life expectancies. So it's something that we at Aurora are very concerned with. Next slide. So this population has both special needs for care and barriers to receiving that care. So special needs come with high rates of chronic medical conditions like hypertension, HIV, and substance abuse, high risk of hospitalization, and a 13 times mortality compared with their peers in the first 2 weeks after release. And this is really, why we were hoping to serve better the population as they are making that very precarious transition from corrections to the community. There are barriers and challenges to getting the appropriate care with medical records. There is underinsurance. This population is primarily Medicaid. I do want to recognize the great work that Corrections has done in making sure that people are signed up for Medicaid as they come out. It's been really helpful. But a lot of people coming out will say that they face discrimination by medical caregivers because of their criminal records. So there is a real need for us not only to know how to deliver medical care, but how to deliver medical care in a culturally competent way and to be trusted. And I think Adam said earlier, and Adam wasn't the only one who said this, but only somebody who's been in those shoes really knows what it's like. And you need that kind of credibility when you're dealing with this population. And that's where our community health workers come in. So next slide. So the model it teaches primary care teams to be culturally competent. So there's cultural humility training for the primary care teams, but also integrates community health workers with lived experience of incarceration into the primary care team. So we've recently hired these community health workers. We have them on the line today, and we learn a lot from them, a lot that we didn't learn in medical school. And it's been a great encouragement to us. And these community health workers connect with people as they come out of incarceration. We're forging some good relationships with correctional health and social workers on the correction side to connect with people before they leave. The community health workers help people navigate care and how to become self-reliant and disease management, and help them to engage with community resources that are non-medical, but also very needed, like housing and employment and so forth. And each community health worker can serve approximately 100 clients per year, and we have 2 at Advocate Aurora Health and 2 at Progressive. And I'm going to turn it over to Jenni from here.
Thank you, Sarah. And I just want to talk a little bit more about the community health workers. And, Sarah mentioned that we hire people with lived experience with incarceration, which is such a key component of this program, as she mentioned, because they have that trust. They have successfully re-entered themselves. And so it's, it was kind of unusual to put a job posting out there that said, must have been incarcerated for at least a year, but it's been great, and we look forward to hiring more people as well. So that gives you an overview of what the community health workers do, just a little bit of what they do. And they are engaged in the reentry community. They are on the reentry council meetings. They're in the healthcare task force meetings. They're engaged in community outreach as well. And they're trained to be community health workers in a program that will certify them as community health workers. And then they're also trained by the Transitions Clinic Network specifically for this program. Next slide. So the Transitions Clinic Network is actually based in San Francisco, was started out there, but there are transition clinic programs throughout the nation, mostly on the East and West Coast. We're the first, Advocate Aurora and Progressive are the first to do it in the Midwest, so we're pretty proud about that. And what the network provides, this is just a few highlights of what the network itself provides. Well, I'll just go off the cuff because I can't say that. That's okay. Training and support for organization teams for 1 year. So we each of our organizations put together a team, and they provide coaching calls once a month. They also provide additional trainings that they make available to us. They provide cultural humility training for clinical teams, and this is like an 11-part series. It's not a half-hour slideshow on cultural humility of this population. It's an 11-part series, and anyone else who wants to take it within the clinics as well. They have ongoing trainings and support for the community health workers, which is really important. They can kind of problem solve with one another and learn from those who have been in this position for much longer. They also provide an annual conference. Of course, last year it was virtual, but nonetheless, there's a lot to learn. And then we also have connections with other TCN programs across the nation and in Puerto Rico. And just this week, we were able to connect with other leaders of other programs across the nation and problem solve some of the issues that some of them were having. So it's a really wide network. Next slide, please. One of the research studies that has been done on the Transitions Clinic showed that the model actually resulted in 50% fewer ED visits, or emergency department visits. And this was over 12 months when compared with expedited care in a safety net primary care clinic, which saves Medicaid $912 per client. It's actually more now because inflation happens in healthcare as well as everywhere else. There were also 50% fewer preventable hospitalizations. So when you connect somebody to a primary care provider that can help them manage their chronic disease, their mental health issue, their substance use disorder, you're not going to see them go to the emergency department for their primary care or for a non-emergency. You're not going to see them hospitalized as much. And when they are hospitalized, they have a reduced average hospital stay. They also found that they had 25 fewer days in jail per year on average, and also fewer technical violations for probation or parole. And this speaks to the importance of working with the Office of Community Supervision to coordinate and collaborate with them. Next slide. So who is eligible for the program? People who have returned home within the last 6 to 12 months and are at least 50 years of age, or if they're less than 50, they have a chronic health need that is manageable by primary care, like a chronic medical disease like diabetes or hypertension, asthma, a mental health issue, or substance use disorder. Right now, we started with internal patients. So obviously, as a community health center, like I said, we serve everyone, including people who have been incarcerated. So we were already serving this population, as was Family Care Center. And so we started with the patients we were already serving and connected them to the community health workers, which kind of helped us work out some kinks as well with patients who already had a trusting relationship with a provider. And we're currently working with MSDF to coordinate care. And I'll speak a little bit more about that shortly. And we also accept outside referrals that meet the criteria. So again, this is the eligibility criteria. And if any of you have anyone who needs a provider who fit this criteria, of course, we will serve them as well. And I'll tell you how to get connected with us in a little bit. Next slide. So how does it work exactly? This is how it's working right now with MSDF. MSDF's social worker, we'll call her Margaret because that's her name. She notes who's being released, who meet the program criteria. And so she talks to the individual about the program to see if they're interested. It's not forced on anyone, of course. If they are interested, then the social worker asks the client which location they prefer, the Family Care Center or Lisbon Avenue Health Center. And we'll fill out a referral form with some basic information as well as a release of information form. And those forms are sent to the appropriate person at the location of the person's choice. So then the person is assigned a community health worker, and that community health worker will reach out to MSDF, to the social worker, to set up a virtual visit to introduce her or himself and the program, and to schedule an appointment. And they can talk about some of the issues or concerns or what have you that the individual has about seeing a health provider or reentering in general. And so they really start building that relationship from the beginning. And of course, with COVID, it's virtual now, and we hope someday to be able to actually go in and meet with them personally. The patient then goes to the clinic for an appointment and meets with the community health worker first for 30 minutes. And they go through an intake packet, which is really a conversation. And then they meet with their physician for 30 minutes. And if the community health worker needs to follow up with them at that visit, they will then continue after the physician is done. But regardless, the community health worker does follow up, offering guidance and resources, and really helps them navigate the health system. We know that health systems are not easy to navigate. And if you've been incarcerated for quite a while, it can be even more intimidating. And so they help them with their care plan as well, and other potential barriers to a successful reentry. Next slide. So we also, like I said, we have specific criteria for the program, for the Transitions Clinic program, but we also will serve people who don't meet that criteria. They just won't be part of the Transitions Clinic programming and get the attention of the community health worker, but of course we will serve them from a primary care standpoint and beyond that as well. So if people want to make referrals, or if somebody wants to refer themselves, if they want to just go ahead and establish care with a primary care provider, here's the contact information. And so you can refer people who meet the criteria, and you would contact the community health workers, okay? Or if you meet the criteria, and you want to establish care, you would contact these community health workers. At Progressive Community Health Centers, we have Maisha Young and Dante Martin. And at Aurora Family Care Center, we have Lavanza Jackson, which I see, Lavanza, I misspelled your last name in your email. So Lavanza, if you could put your email address in the chat, I apologize for that typo. And Ty Minor. Okay, and I'll make sure we get to introduce them at the end as well. So next slide. And then for those patients who don't meet the criteria but want to establish care, we still will see you, like I mentioned, at Progressive. You just have to call this number and make an appointment, and that's regardless of whether you need primary care, dental, or both. And Aurora Family Care Center, this is the number that you will call, and these are our locations as well. And next slide. Before we get to questions, I would love it if, and I'm not sure if Maisha is on, because I know she had patients, but she might have been able to pop on afterward. So maybe we'll start with introducing Lavanza Jackson. If you want to pop on and say hello, Lavanza.
Good morning to everyone.
All right. And Ty Minor.
Can everyone hear me?
Yep. And so Lavanza and Ty are at the Aurora Family Care Center. And then Dante Martin.
Yes, hello everybody. I'm having technical difficulties with my where you can't see me. I can see you all, but I hope you can hear me. It's a pleasure to be here. But I do want to say one thing on the flyer. The 1166 is my extension and 1167 is Maisha's extension. It's switched around. So either way it go, we'll still be able to get in contact with you guys. So thanks again.
Awesome, thank you. And is Maisha on?
No, she's actually dealing with some clients right now. Okay,
perfect. All right. So we have 4 wonderful community health workers who are very passionate about the work that they do. And we're already helping the community in various ways before we snatched them up and were able to hire them. And so that is it for now. Do we have any questions about the program? I know I went through a lot of information quickly, but I wanted to make sure I covered it all.
I have a question, Jenny, which I think you answered, but just to reiterate, people who may not fall within that narrow definition of specific cases that Transitions Clinic focused on are still welcome at your two clinics, or at your multiple clinics, Advocate Aurora and Progressive, correct?
Yes, they are. They just won't be part of the Transitions Clinic program, but we certainly will serve them like any of our other patients. They can get primary care at Progressive. They can also get dental, behavioral health, and so forth.
Thank you.
Excuse me.
Yes, Sylvester.
Yeah, how you doing? Sylvester Jackson with Expo. I wanted to follow up with Connor's question. I was concerned about that as well. Like, is there a particular group, like say, for example, individual coming home from prison is a part of the program, or just particularly MSDF individuals?
Yeah, thank you for that question, Sylvester. Yes, we will take people who are coming home from any of the facilities. We just have this coordinating, this coordination with MSDF right now, but we will welcome anybody who meets the criteria from any of the facilities.
Thank you.
Questions? Jenny and Dr. Sarah, thank you, and thank your team. Presenting was quite informative. Thank you so much. And I think if anybody needs to get a hold of you, they can, correct? At any point in time.
Absolutely, and we can send the presentation out so people have the contact information as well.
Okay. And maybe Mandy can help with that distribution as well.
Sure.
Okay, thank you. And I just realized I'm very grateful for Mandy, how she was able to put everyone in the box talking next to you. And Mandy, thank you for learning all that, because I have no idea how to do any of that. So, all right.